Adding some volume to forehead looks people look more younger. Under the sunlight or inside the room, like any type of light touches the properly volumized apex of the forehead, so it makes the skin look more brightened. Like here, the sunken area of the frontal bone, with the filler use, we can feel this area. So the surface of the forehead will be more smooth. I prefer filler with low to medium viscosity because it can spread easily and widely all over the forehead. Forehead is very wide area. Only using local anesthesia cream would not be enough for pain control. So before, I used to use supraorbital and supratrochlear nerve block. If you want to feel the temporal area here, I recommend you to block the zygomaticotemporal nerve block also. But today, I'm going to use this medium viscosity filler. And this contains lidocaine itself, so I'm going to skip nerve block part. I use fan technique, the fan. So imagine the shape of the fan. I will show you. First, I will use 23 gauge needle and I will puncture the skin here. And then I will use 25 gauge cannula. I recommend to use cannula rather than needle because there are many blood vessels here. So if you use cannula rather than needle, you can decrease the risk of puncturing the vessel. Of course, in that case, you will have lower chance to face the side effects. So insert the 25 gauge cannula on the supraperiosteal level. And in this patient, actually the frontalis bone here is very protruded and relatively this part is very deepened, the sunken. So I will feel here, 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 the sunken area. And as I told you, I will use fan technique. Fan technique means imagine the fan shape like this. So go back and forth with the cannula and gently insert the filler. So focus on the way the cannula goes back and forth in the fan shape. Of course, the amount of the filler injected depends on how much sunken or how much depressed the patient's frontal bone is. Well, this time I injected half of 1 cc to fill the central area with fat technique. And now I'm going to gently press and massage here for the filler to be evenly spreaded. Now you can see a little bit volumized central part of the forehead. And then now I'm going to feel the lateral side here. So puncture the skin with the needle. And draw another imaginary fan here, the lateral side. And go back and forth and fill the filler. And gently massage the injected fillers. Okay, from now on, I'm gonna fill the remnant lateral side here. Puncture the skin to touch the bone. Of course, you have to touch the bone with the needle because we'll insert the filler on the supraperichondrial layer. and insert the cannula and draw another fan here going back and forth. In this patient, I will insert 0.5 cc. And gently massage the injected site. Once you think you injected the proper amount of the filler, as I told you, the gentle massage to spread, for the filler to be spread evenly throughout the whole forehead is very important. So I'm going to use the soaked wet gauze to gently give pressure on the forehead. I like to use the soaked gauze because with this, from my experience, even and gentle pressure can be given throughout the whole forehead. Because if you use fingers to massage here, actually there could be some mark of the fingers because the filler can be very moldable. So that's why I prefer the gauze. So, can you please look at the mirror? Well, I injected 1.5 cc of the filler. Well, actually, it's very small amount for the filler because in average, we insert 4 to 6 cc. So actually, 1.5 cc is not enough. So let me insert a little bit more here to volumize more, and then I will insert the filler a little bit on here, the temporal side. So look at the mirror. Do you agree? Mm-hmm. Okay. Okay, first, so still I notice a little bit of sunken area here, so I'm gonna fill a little bit more in this side. So you see the cannula that I'm drawing the imaginary fan shape. With this technique, you can evenly inject the filler. So use the gauze and fingers properly for even distribution of the filler. So one of the good things of filler compared to fat injection is the filler is very moldable. And now I'm going to fill the volume here on the temporal side. After puncturing the skin, also touch the bone and use the cannula on the subcutaneous and suprapericondylar area. So to fill this temple area, puncture the skin a little bit lateral. Insert the cannula alongside the supraperiosteal area.